Hey there, my name's Marcy Evans. I'm a registered dietitian in private practice in Cambridge. And today I'm going to be talking about the intersection of digestive health issues and eating disorders. And anybody who follows me in social media, follows any of the work that I do, knows that this is something that I've been talking about quite a bit over the past few months. Recently, I was on a Facebook group where this question got brought up again, and I offered the idea of doing a video blog on some of the questions that were raised in the group, and there was a resounding yes. So I have to just sort of preface this video blog with saying that it's incredibly difficult for me to try to synthesize my thoughts into a 5 or an 8-minute video blog when there's so much to say on this topic. And in fact, I'm just going to let each of you know that I am in the process of developing an online self-study course on this topic that will probably end up being about 3 hours long, that really dives into all of this in detail. It's designed for clinicians. However, those of you who are science-minded or interested will probably benefit from the course as well. So I would just say keep your eyes open for that announcement when the course goes live. I'm shooting for May, but we'll see. And then the other thing I want to mention is that I'm going to be speaking with the EDRD Pro Symposium, and can provide links in the blog post where I'm going to post this video blog. I'm going to be speaking on this topic as well during doing sort of a version of this talk, but this is a very, very rich topic of conversation, and there's a lot to be said. But essentially, why I developed this video blog is because so many people with an eating disorder or past history of an eating disorder start to have trouble with their digestive system. They're in pain, they're gassy, they're bloated, they're not going to the bathroom regularly, and it's really affecting their health and their well-being and their quality of life, and they feel sort of desperate to fix the problem, and yet are rightfully so really wary about doing an elimination diet, which tends to be the go-to sort of tactic to address any sort of IBS-like symptoms. So I thought I would offer my thoughts on the topic, given all of the research that I've done on it and the fact that this is something that I feel pretty passionate about. So one thing I want to mention is that I am not a big fan of full-blown elimination diets in general, but when it comes to people who have a history or an active eating disorder, I do not recommend full-blown elimination diet protocols. They are exceedingly hard to follow and are incredibly restrictive. And what happens is that when you have an eating disorder, you have sort of the neurobiology in your brain of those restrictive thought patterns that are incredibly triggering. So when you go on an elimination diet protocol for digestive health issues, your brain doesn't really know the difference, and it can be very, very triggering and problematic. So the way I explain it to my clients is that when you have an eating disorder, or any time where you have two problems happening simultaneously, you really have to approach things in a thoughtful, unique way. I think often people who work in the sort of digestive health realm, who don't have training in eating disorders, don't necessarily know that you really kind of have to hold things, both of those things, at the same time, and that you might approach things a little bit differently. So a couple things that I want to share with you, kind of diving down into the specifics, is that one of the reasons why there is such a common occurrence, I'm talking well over 90% of the people who have an eating disorder or eating disorder past have digestive issues. I mean that's crazy. Well over 90%. It's vast majority of people. And the common denominator between those functional gut health issues and the eating disorder is the mental health concerns, including anxiety and depression primarily. And so why this is so significant is that often when people are having trouble with their body, right, their stomach is hurting, they're bloated, the first line of attack is to address it with a physical solution, right? Do an elimination diet. When the common core issue between the two is what's going on with your mental and emotional well-being. And so the way I approach this is thinking, wow, if we can try to solve both problems, the digestive health issues and the eating disorder issues, we are really going to be using a much better and much more effective approach. So that's the first thing I would think about, is what are the ways in which you are working to, as best as you can, and I know it's very difficult, reduce the levels of anxiety in your life, using good self-care, trying to get as much sleep as you can, using breathing techniques, having good supports, all of those things that support bringing down those sort of stress levels that get internalized in your body. And so one of the things that I often say is that being a stressed out person, it's not some big surprise that you may also have a stressed out gut. And so really thinking of that as your first line of defense. And there are lots and lots of ways that you can go about it. I've named just a couple, but there's also a whole comprehensive way to go about sort of addressing both simultaneously using a mental health lens. And the reality is that going on a full-blown elimination diet protocol can actually be very, very stressful. So that's also something to consider, particularly if you are in recovery or trying to be in recovery from an eating disorder or maintaining your recovery. So some other things to consider is that digestive discomfort, aside from being caused by, maybe being an anxious person or suffering from depression, has a lot of other potential causes. Some of them may be some food intolerance issues, and I work around that as creatively and thoughtfully as I can. But it can also be caused by the anatomy or structure in your body, which would be something that would need to be tested for. And it can also be a side effect of medication. So if somebody is on a medication to help manage their anxiety that also might have a side effect of maybe disrupting their digestive system, getting to an elimination protocol or taking things out of the diet might not actually have the benefits because you're not treating the source of the problem. Now, I am not suggesting that if you are having IBS symptoms that you should just go off of your medications to treat, say, your anxiety or depression. I'm not saying that at all. I think those medications can be helpful, but it means that we can get creative around finding other solutions, using deep breathing, using things like yoga, trying to bring those stress and anxiety levels down, could be a first line of defense. Other things that you can utilize are digestive supports, so things like digestive enzymes and probiotics. However, I would say that often those are used sort of just like a recommendation of everybody go on a probiotic, which I don't agree with. I really recommend that if you decide to go that route, that maybe you either talk to your doctor about it or you talk to a dietitian about it who's knowledgeable, because the different strains of probiotics have different effects and everybody responds to them differently. So that gets a little bit complicated. I'm going to be talking about that in my training, but just know that there are some safe supplementation options out there that you could try before going the elimination diet route. The other thing that you can do is maybe see if you can observe if there are particular things that seem to cause a problem every time that you have it. So for example, I love dried mango, but every time I eat dried mango, it's like my stomach fills up with a balloon, it fills up with a bunch of gas, and it's really uncomfortable. So I've been able to notice that pattern. I don't need to go on a whole elimination diet protocol to identify that. Now, sometimes it's not always that easy, it's not that straightforward, but if you can sort of say, I'm going to explore and sort of notice, is there something that maybe I could make a different choice or take a break from that choice that wouldn't feel triggering to your eating disorder, you can try that on. And again, I'm trying to delineate the difference between doing very, very small scale experiments, which is an entirely different approach than doing a full-blown elimination diet protocol, which again, I don't recommend for people who have a history of an eating disorder or an active eating disorder. Now, the last thing that I would mention is that many of these things can be tested for. So have you been ruled out and tested for things like celiac disease, lactose intolerance, fructose intolerance, small intestinal bacterial overgrowth, the health of your pelvic floor? So these are all things that you could talk with your doctor about and say, hey, I really don't want to do an elimination diet. I have a history of an eating disorder. It's very, very triggering for me. I want to really stay focused on my recovery. But could we use some medical testing as a way to rule things out and sort of help you to focus on where maybe you want to put your effort? So hopefully that gives you some good ideas and gives you some ammunition if you're sort of thinking about a full-blown elimination diet and why that might not be the best idea, but to not cause you to feel hopeless that there are many, many other safe, supportive solutions to help you feel better physically. And one of the things that I know without a doubt is that digestive problems are a big risk factor for the development of an eating disorder. It makes eating disorder recovery very difficult. It has a negative impact often on body image, and that as we empower you to feel more comfortable, healthy, better in your body, you're going to be able to feel more confident and empowered in your eating disorder recovery. And I want you to have my reassurance that both things are possible. It takes some creativity, it takes some resourcefulness, but there are options out there, and I wish you all the best.